back, guys. So now in this part of lecture, we're going to talk about disturbed sleep, right? Or when sleep quality starts to go by the wayside. So it's actually pretty alarming if you look at the data on this. 50 to 7 million adults in the United States experience chronic sleep disturbances. 62% experience sleep problems several nights a week. It's a pretty big issue. We actually think it may be even higher because a lot go undiagnosed and untreated. Think about it. You go to a primary care clinic, your primary care doctor is usually the ones who are assessing this. And they're looking at your blood pressure, they're looking at your activity, your body weight, medications, all kinds of stuff. Like there may not be time for them to ask you about your sleep, despite the fact that this has impacts on everything regarding our health. So this may be why, we may even have higher numbers potentially. It may also explain some of the issues that we see with cardiometabolic diseases and certain other conditions we'll get into later that are kind of growing in the United States as well. It's interesting that we think this may actually be getting a little bit worse, could be getting better, but in terms of sleep quality, and we'll talk about why there may be a little bit of conflict in the literature. So 12% of U.S. adults reported less than 6 hours of sleep in 1998. However, that prevalence has increased, right? And this is data from 2015, but estimates, or reported in 2015, estimates that during 2007 to 2010, that's up to 37.3% of U.S. adults reporting less than 6 hours or less, and only 6% reporting 7 to 9. Again, it depends on the literature you read, but there is a concern that we're seeing more and more of this, and maybe a lot of it's going undiagnosed or just untreated. And again, we'll detail why that could be a big problem. So I do want to stress that there is a difference between disturbed sleep and a sleep disordered. So a disturbed sleep is like an acutely disturbed sleep pattern or cycle, right? Like you slept, you pulled an all-nighter and you got only 4 hours of sleep in one night. That's an acute disturbance. That's not a sleep disorder unless it happens chronically, right? You're chronically not getting good sleep. A sleep disorder is a chronically disturbed sleep pattern, right? There's 80 known diagnoses, right? Insomnia, we'll get into that. Sleep apnea, or restless leg syndrome, hypersomnia, just excessive daytime sleepiness, which is related to narcolepsy, falls underneath that category. These are sleep disorders. It's a big difference between that and disturbed sleep. So disturbed sleep, acutely disturbed sleep patterns. Sleep disorder is a chronically disturbed sleep pattern. If you don't fix a disturbed sleep, it could become a sleep disorder or disordered sleeping. So again, disturbed sleep or sleep disturbance versus sleep disorder. They're different terms here, right? So I just want to emphasize that. So common sleep disorders, and again, there's 80 of them. There's a lot of them. But these are kind of the four biggest ones that we see in the United States. Insomnia, being unable to fall asleep and stay asleep, heightened by that they have that really long or extended latency period, like they just can't fall asleep for whatever reason. We don't have that S and C processes. They're not working well in sync with each other. It's actually the most common sleep disorder, right? Is insomnia. Sleep apnea, which is growing in prevalence. It's periods when we don't have any breathing or apnea or inadequate ventilation lasting greater than 10 seconds and occurring more than 30 times per an episode of sleep. This is strongly linked to a lot of conditions, but heavily linked to obesity. Actually, the more obese you are, the higher risk is for developing sleep apnea, especially obstructive sleep apnea, where we have compression of the upper airways. And again, that goes back to what happens normally. Our airways become a little bit less, become more relaxed in our upper airways. We don't see as much activity to those laryngeal and pharyngeal muscles. We see a reduction in intercostal muscle activity, and the diaphragm has to kind of take up the slack. If you've got a weak diaphragm and you've got obesity, we've got more neck fat, and as well as changes to that cartilage and those muscles, you're setting yourself up for potential problems. That's why we see sleep apnea quite often in patients with obesity. It's a big problem. Restless leg syndrome. So that's unpleasant sensations in the leg with a powerful urge to move. There's four distinct classifications for this, but that's a general sense of what restless leg syndrome, and you can see how that would disturb your sleep. or disorder your sleep. And there's hypersomnia, which is trouble staying awake during the day, right? So you can't stay awake because you're just not getting good sleep, and then prolonged nighttime sleep. So I want to stress something that 7 to 8 hours is the ideal window. And again, there may be different age-related changes. If you're requiring 10 hours of sleep each night, that's not a good sign either. Remember that U-shaped curve we see in physiology. There's always a sweet spot, Goldilocks zone. Too low of sleep isn't good, and too high of sleep isn't great either. That could indicate you got something underlying that's not good, right? Something's arrived, because we should be falling in that sweet spot of about 7 to 8 hours of good quality sleep. So if you are requiring a lot more than that, there's something going on there, right? It's not normal. Okay. So, but bear in mind, everyone's a little bit different, but just to be aware that more sleep each day is not necessarily a good thing, right? Because we're looking for that 7 to 8 hours. So some common signs of sleep disorders, or even just disturbed sleep, but really sleep disorders, is if they regularly need more than 30 minutes to fall asleep. That's really strongly linked to insomnia. They just can't fall asleep. That cycle is just not there. Those hypothalamic neurons just aren't there. They're not working. They wake up regularly, right? Several times each night, and really just struggle falling back asleep. So they wake up, can't go back to sleep, or they wake up way too early in the morning. Like that's not a good sign. Or if they feel sleepy throughout the day, or hypersomnolent, they're just always just tired. They got to frequently nap because they're in a sleep debt, and they fall asleep throughout the day. Like that, again, that's that hypersomnolence, that narcolepsy, right? They're always asleep, right? They're always falling asleep. Another big one, kind of related to sleep apnea, is loud, snoring, snorts, gaps, choking noises, or periods where you stop breathing throughout the night. There's actually a questionnaire called the Pittsburgh Sleep Questionnaire, which actually asks patients, their partners, like, hey, like, what do you experience when the patient's sleeping? Because you sleep next to them. And again, snoring, especially loud snoring that happens often, this gasp and choking noises, like that's strongly linked to sleep apnea. And again, there's other ones there, like, if you got, weird arm movements that happen during sleep, very vivid dreamlike experiences while falling asleep or dozing, sudden bouts of muscle weakness or catatonia, which is linked to narcolepsy, an inability to move after your first wake up, that's not a normal sign, or those creeping, tingling sensations, which is related to restless leg syndrome. Now, there are some risk factors for poor sleep quality. Again, these aren't risk factors per se for sleep disorders, but overall poor sleep quality. Okay, obesity, being physically inactive, smoking, and excessive alcohol. Right. It's actually important to note that alcohol, like while it may be kind of a depressant, it actually can cause you to wake up more frequently throughout the night. Like you should not be using alcohol as an aid to put you to sleep. Like it's not recommended. Not only because it may disturb your sleep when you're trying to sleep, it may also, again, if you drink too much, could lead to risk for aspiration, because it's going to even further weaken your upper airway structures, make them more relaxed. If you smoke, if you're inactive, and obesity. Obesity is one of the bigger factors, and I think that has a lot to do with the respiratory muscle changes that happen with obesity. And then here's some chronic conditions associated with poor sleep. So heart attacks, heart disease, stroke, COPD, depression, diabetes, a lot of different conditions we see pretty often, and that explains kind of why we may be seeing more sleep disturbances. Because if you have a chronic condition, it's going to make it harder for you to rest. And as you guys remember, like these are pretty common risk factors, right? Heart disease is our number one killer in the United States. So again, like these things kind of, as we'll kind of go through, they're intertwined, like these chronic conditions and sleep. We think sleep can contribute to some of these chronic conditions, and these chronic conditions can contribute to poor sleep. They go kind of one and the same. And again, in the United States, we see a lot of these. So maybe there's an underlying cause for these conditions, and maybe there's an underlying cause for why we see inadequate sleep. We think maybe perhaps there's impacts of our modern life, right? For many years, sleep was viewed as a luxury, like especially after the dawn of the industrial era. When we're our age when we're people are in mills working around the clock. The concept really even of weekends is a fairly new concept in the history of mankind. Usually, you just worked every day. There wasn't an off day. So it's just something interesting that conceptualize. But the biggest thing that we're concerned about, especially in young kids, is exposure to blue light. So your cell phone, your mobile device, your iPhone, Android, any of those devices, our smartphone or iPad, emit this artificial blue light, which actually suppresses the release of melatonin. Again, remember, melatonin, gets increased secretion as we move to night when those light sensors notice that there's less light coming through them. The SCN stimulates the pineal gland to release melatonin, and that helps us sleep, right? Because it kind of ramps us back down. Blue light limits that, so it's really important that we limit blue light exposure at least 1 to 2 hours before going to bed. You could read, do something else, but don't be looking at a screen right before you're going to bed. It's going to make it harder for you to get good quality sleep. Stress, like in modern life, we a lot of different stresses now. People driving in traffic, dealing with crowds, COVID. We're dealing with that right now. The different infections. If you look at places where there's refugee situations or emergency situations, stress is super high. Sleep quality kind of goes by the wayside and gets really impacted. Academic stress is heavily linked to poor sleep quality. In fact, it's a bit of a concern in college students, high school students, and graduate students of all kinds. Lack of physical activity. As we know, people in the United States are becoming less and less active. 80% of people don't meet the recommended guidelines of 150 minutes of exercise or activity per week. And then, it's actually interesting that we think, if you are actually active, it can potentially protect some of the stresses. So, we'll get into this, how these things are so linked that, a lot of the risk factors we see for sleep and like how sleep can in fact impact these risk factors are linked. And a lot of times doing things to improve overall health improves your sleep. So people who get above the minimum, we think can help protect your ability to deal with stress, which can lead to better sleep. It's actually pretty interesting. And this was been looked at in particular in college students, on their ability to tolerate academic stresses and maintain good well-being and sleep by being active. So stay active. It's super important. So while we think, again, there's trends that we're concerned about increasing poor sleep quality, there are shifting norms. I think just more people are aware of how important sleep health is. Like I think there's like 800 different apps in the App Store to monitor your sleep. There's 50 different devices you can buy now for commercial use, despite only one is FDA approved, I believe. So we're more aware of these things. So we may be shifting towards improving sleep, but it's just something to be aware of, that this is still a big problem. And if we look at trends, there are some geographical distributions. So if we look, similar thing as we saw before, looking at the Southeast, Midwest, we see geographical influences on sleep. And if we break this down even further to the county level, this is a prevalence of individuals who get less than 7 hours of sleep. So this would be objectively poor sleep quality. It's from the BRFS surveillance system, right? So again, you look at certain areas of the country, right? Now there are definitely geographical distribution. You may wonder, like, if we overlay this to the obesity map, the inactivity map, the heart disease map, the hypertension map, even some of the other chronic conditions, they look identical, right? It just shows you, there's bigger things at play here than individual determinism. There's social forces here, maybe economic forces, and we'll get into some of those factors in a bit too. Maybe temperature, right? It's hot in some of these countries. It's really hot. And we know, like, really hot ambient air can make it harder for you to fall asleep. I don't know how many of you guys have lived in the deep south. I spent some time in Florida. I've spent a lot of time in Texas. I spent a lot of time in Tennessee. When it's hot out, it is hard to fall asleep. In certain parts of the Midwest too, Chicago, in Nebraska, it can get even really, really hot. So think about these things and think about social forces that may be at play here. Then think about even like large cities, right? If you have really loud cities, it's kind of hard to fall asleep. There's just a lot more noise, right? So I want you guys to think broadly. So there's been some great data that's been published looking at this, and it was in the Singerson paper in 2020 that was published, who highlighted some of these figures here that people who don't complete a college degree are more likely to get less sleep compared to college graduates. Earning less than $75,000 a year is associated with very poor sleep duration. People with low food security are more likely to report poor sleep. Sharing a bed. So if you live in a crowded house, maybe you have to share beds with multiple people. You got 6 people living in your house, a crowded house. It's going to be more noise, maybe more stress. In fact, even if we look at neighborhoods, right? So a neighborhood disorder is a measure of the degree to which a neighborhood is perceived as noisy, dirty, or crime-ridden. We found that a great study by Hale found that neighborhood disorder is associated with poor physical health that's associated with sleep quality even after controlling for other socio-demographic factors. This shows you that sleep is such a strong factor. In fact, that for every one standard deviation higher on a scale of neighborhood cohesion, which would be the opposite of disorder, so every standard deviation in a neighborhood is less disordered, and more safe, sleep duration increases by about 8.5 to 9.4 minutes respectively. So the more safe your neighborhood is, the more sleep you typically get, right? If you live in a very dangerous neighborhood, one, you're going to be stressed. There's going to be disturbances, right? Which may explain why we see people with low education, low salaries, right? Because anxiety, if you're constantly thinking about these things, or if you have a lot of stress, or you're in a crowded space, it's going to impact your ability to get good sleep. There are social forces here. In fact, again, sleep quality explains 20% of the neighborhood disorder and self-health related health and depression. Like sleep, again, is it's intertwined in so many of these societal issues, chronic conditions. And again, it's why we see maybe why we see some of these rampant conditions of diabetes, hypertension, obesity, maybe crime in certain areas, just because it's linked to just bad sleep, right? It's something to think about. And again, effects of disturbed sleep, it's going to affect your immune system. We know that's going to be really, really involved here because our immune system kind of, again, proliferates or produces our antibodies. In fact, if we get poor sleep, we find this low-grade central nervous system inflammation. We think impairs our ability to modulate pain and perception. Chronic pain and impaired sleep kind of go hand in hand. We find that when we don't get good sleep, we don't get good downregulation of the sympathetic nervous system. So typically when we're sleeping during those NREM stages, our sympathetic nervous system is decreased. So if that isn't, we see higher sympathetic nervous system outflow. We know that noradrenaline signaling through the beta-adrenergic receptors activates different enzymes and processes which increase the production of cytokines and maybe systemic inflammation. So if we're not downcycling and bringing ourselves into that sympathovagal balance by having good sleep, it can lead to higher production of inflammatory cytokines, setting the stage for a lot of other problems. We see weight gain and dietary intake changes. If we're sleep deprived or have disturbed sleep, we tend to crave higher energy density foods, more calories per gram. So that's like cookies, donuts, potato chips. And you guys can kind of think of that too. If you ever had a really rough night's sleep, you probably want to have some pancakes, probably want to have some good greasy breakfast food. And that we think that has something to do with our olfactory nerve changes, ghrelin, secretin changes as well. So we think that may explain if you're if you don't get good sleep, you don't consume healthy food, you consume really high caloric food, and that leads to weight gain, right? And then weight gain can also lead to worse sleeping. You can see how these things cycle into each other. Impaired motor learning, again, or just impaired learning in general. Again, because so much of it happens during sleep, with those, especially at stage 2. Impaired cognition, right? Especially we're looking at those Alzheimer's, Parkinson's. Again, sleep health or sleep hygiene is brain hygiene. Again, that's where that glymphatic system turns on and moves all of that waste out. Physical activity, like if we don't sleep well, we're not well rested, we're not likely to be as active. And again, if we're not as active, we're not likely to sleep as well. You can see how these things ramp up. Impaired vascular health. In fact, here's a plot looking at blood pressure changes, ambulatory blood pressure changes in someone who has a normal day's sleep and then insufficient day of sleep. So you can see here, so SBP1 is a sleep insufficient day. DBP1 is blood pressure on an insufficient day. You can see compared to a normal healthy day, SBP2, so you get adequate sleep. It's applied someone with adequate sleep with 2. So the top, SB1 and DP1 is insufficient. You can sleep. You can see much higher blood pressures throughout the day. And again, if you chronically get bad sleep, think of what that does to your vasculature. We know that actually, in fact, that inadequate sleep leads to poor vascular health in the cerebral vasculature, specifically the small vessels there, leading to risk for stroke and other complications. And again, this is a nice kind of model here for what we're seeing. So you have that psychological stress, environmental stressors. You have this dysregulation in the hypothalamus. Again, that process S, process C are out of balance. Decreased melatonin excretion, right? Especially if we get a lot of light, a lot of disturbances. It's not getting into a normal cycle. Leads to sleep deprivation, too much arousal, which raises nocturnal sympathetic activity. Again, sympathetic activity during sleep during the NREM stage, which should be 75 to 80% of sleep, should be lower. If we get less of that, we're going to get more sympathetic nervous system activity, which will lead to potentially diabetes, hypertension, maybe setting the stage for coronary artery disease. These things are all linked to each other. And again, people often with coronary artery disease, diabetes, other conditions, diabetes can lead to chronic pain, neuropathic pain, which can impair, sleep as well. We know that coronary artery disease is linked to poor sleep as well. So again, these things are cyclical to each other, and sleep is a key part here. Again, this kind of looks at how, again, another model of how these inflammatory markers are involved. So again, like if we have disturbed sleep, impaired efficiency, inflammation affects the sleep architecture, and then we see changes in inflammation, systemic inflammation, decreased immune response as well. So we have a higher susceptibility to infectious conditions, as well as developing chronic conditions like depression and Alzheimer's disease. So again, these things are all linked to each other. So sleep, again, such an important role. And again, I want you to think about this concept of this bidirectional role, like doing the double, right? Sleep impacts what we eat, but what we eat also impacts what we sleep. An unhealthy diet, which is highly high carbohydrate diet, linked to not super great sleep. And interestingly enough, if you eat what you're supposed to eat for a healthy diet, which is high in fruits, veggies, whole grains, vegetable oils, and lean meats, the typical Mediterranean diet, that's actually linked to good sleep. So what you would do for overall health typically is good for sleep health. Sleep disturbances, which is one of the most common complaints amongst the patients with depression, is also a potent predictor of depression recurrence. Like these things feed into each other. Pain can be worsened, can be associated with sleep deprivation. So if we have sleep deprivation, it can worsen our severity of pain because that's systemic inflammation, impairs our ability to downregulate pain. But pain can also disturb sleep, right? Good activity can promote good sleep, and a lack of activity can impact sleep quality, and lack of good sleep can also impact your ability to be active. These things all feed into each other. I really want to stress that we see risk factors for poor sleep, which are tie into some of the effects of poor sleep. These things are kind of one and the same in many respects. It's cyclical; they feed into each other. And again, I often get asked this: can I make up for lost sleep? What's the role of napping? Well, bottom line is there really is no real way to recoup lost sleep, right? There really isn't a way to do it. In fact, you often hear people say, well, like, I didn't get, I slept only 6 hours a week, but I sleep 10 hours a week on the weekend. Well, what did we say? You really only should be getting 7 to 8 hours per night. Going above that indicates you're in a deficit. Your body needs more sleep. That's not a good sign. So, like, making up things, temporarily, you get a bad night's sleep and you sleep a little bit longer, not a bad thing. But your sleep, as we'll get into when we get into assessments, you should try to make that as regular as possible and strive for that 7 to 8 hours of good quality sleep. And importantly to note that a nap can lower your drive to sleep. And it breaks up that cycle. Again, your body is expected to be awake and aroused throughout the day, right? And then kind of taper off throughout the evening. If you're throwing in a period where you're sleeping for long periods of time throughout the day, it's going to make it very hard for you to get a good night's sleep, right? So again, you should really try to limit naps to about 30 minutes tops and avoid napping in the evening because it's gonna affect your ability to get a good, restful full night's sleep in the evening, which is when you really want it. Um, we do think there may be some benefit. Again, we've actually found that very recently the 1 to 2 naps per day might be protective for vascular disease compared to people who don't nap. But maybe these are people who who have poor sleep and don't make up for it. And we actually found there's a really U-shaped relationship. So 1 to 2 naps per week, lower risk. However, 6 to 7 daily naps, higher risk. And again, more that U-shaped relationship, you can't escape it. More naps is not better because that likely indicates you are getting very, very poor sleep because you gotta make up for the limited amount of sleep you got at night. And again, you really need those 4 to 5 cycles. If you're not getting that, you're not getting good sleep. There's really no way to make it up. And interesting thing is, there are studies demonstrate there are really no benefits to napping. So it's inconclusive. If you do nap, limit it to 30 minutes, and especially don't nap in the evening because it's going to really impact your ability to sleep at night. It's like the whole thing, don't spoil your appetite. Don't spoil your appetite for sleep. Okay? So in the last unit, we're going to go over some assessments for sleep and then some basic recommendations you can take and follow for improving your sleep and improving the sleep of your patients.